I'm going to ask you guys a question, and I'd like each of you to answer, and answer correctly, if you want. And that is, from your perspectives, which are linked to your particular professional areas, I'd like you to comment on the degree to which you are exposed to an interprofessional philosophy now, and how you might see that changing in the future as the campus develops.
Wasn't aware I was going to be taking a test today. So I think that as nurses, we obviously, especially in acute care settings, we work with all disciplines. One of the things that the College of Nursing really stresses is being ready for that kind of communication as we graduate and become nurses. And I think that having a medical school, having a pharmacy school that's just right next door to our building will really help us to be prepared for those interactions, be able to provide training for those interactions in a more controlled environment rather than what we get now, which is in a real practice environment. So I think it just really increases our ability to be ready.
So for a pharmacy perspective, I think in the past it's always been just dealing with drugs, and a lot of people have the misnomer that we count by fives all day long. That's unfortunately not very true, but what they're teaching us now is a lot of communication skills, dealing with other healthcare providers, working with physician assistants, nurse practitioners, physical therapy students, dental hygiene students. And it'll make for a smoother transition, I think, in the future when people are looking for healthcare. Everybody's on the same page, and it's a much better approach to healthcare than what we've had in the past.
So when I came here as a first year, we took a lot of courses with the dental students in town. So we were right off the bat kind of integrated into an interdisciplinary education. Along the way, we've also worked with pharmacy students in our Grands Rounds courses, work in a volunteer clinic on the weekends, oftentimes with PA students from the community. And definitely once we hit the clinical rotations as medical students, we're constantly interacting with pharmacy students, nursing students. I see them every day, and the more and more I get into practice, I learn how reliant we are as physicians in training and ultimately physicians on our nursing staff and the pharmacists and everyone else. So, I mean, it really comes down to a team atmosphere to help patient care move along in the best way possible. And the best way to prepare us to do that efficiently is to kind of get us going early on. And I think they're doing a great job, and this new building is going to open up many more possibilities to improve that.
So did they pass their pop quiz?